I'm Vallabh Janardhan, the chair of the Stroke Center Certification Workshop, and I just want to welcome each one of you for taking the time to be able to make it for this workshop. I think people are still having breakfast and they'll join us, but in the interest of staying on time, I'd like to just get started. First of all, I want to just share a few housekeeping issues. We're going to have sessions, 6 sessions during the course of the day, and each session will have around 2 to 4 talks within those sessions. And if the speaker finishes their talk on time, we'll have maybe a couple of questions if there are from the audience. If not, we will just hold it for the end of the session. Each of the speakers can make their presentation and then have a seat at the podium, and at the end of the session we could have questions. In addition, there's continental refreshments outside if anyone wants, and there are restrooms just down the corner. And I think those are the housekeeping issues I wanted to start off with. So, from a big picture standpoint, the reason this whole workshop came into fruition is we've seen chest pain centers develop, primary coronary interventional labs develop, and heart attack care going to new heights with endovascular therapies. Similarly, with comprehensive stroke centers, primary stroke centers, and stroke-ready hospitals, along with stroke interventional labs, brain attack care is set up in that same direction. I wanted to bring in all the key stakeholders for stroke center development and creating the infrastructure for this operational rollout, namely the certifying bodies, health system administrators and hospital administrators, stroke center leadership, physician, nurse, as well as stroke coordinators, and device industry, as well as telehealth industry stakeholders. So we could all partner together and understand how we can evolve stroke centers together in this next decade. I'd like to begin by inviting our first speaker, Dr. Tanzila Shams, and she is going to talk about accreditations, certifications, designations in stroke systems of care. And all those terms are really confusing, and which is why we wanted to start off the session with the basics so that we can build on that as the day progresses. We've got a great packed day of events, including a couple of roundtables from the telehealth industry as well as the medical device industry later in the morning. And we've got a boot camp to wrap up at the end of the day. So I want to thank you all again for taking the time, and welcome to the second annual Stroke Center Certification Workshop. I'd like to invite Dr. Shams for the first talk.
Good morning, everyone. Thanks for coming so bright and early. Can you all hear me? Yeah. Which button to advance slides?
The green forward.
Okay, so today I'll speak about, like Dr. Janardhan mentioned, accreditation, certifications, and designations. All these terms are very confusing, and what do they all mean? And I'll just give a brief overview of each terminology. To start with, I have no disclosures. So, accreditation and certification. And this is the first section. And then there's the actual stroke certification itself. And then there's stroke designation. And then there's the EMS triaging plan. So what is accreditation? Accreditation is, it is a facility-specific term. It's a comprehensive evaluation of the overall quality and the safety standards of the facility itself. It's organization-wide. It is not disease-specific. It's reserved to recognize the evaluation of a set of standards across the entire organization. This is done by JACO, and it can be for anything from acute hospitals to nursing homes to any facility. What is certification? Certification demonstrates a commitment to excellence in providing disease-specific services in a comprehensive manner. Certification standards evaluate the scope of a specific disease or service and a program's effectiveness in using clinical guidelines and performance measurement to improve care. So certification can be anything specific like heart failure, like we're here today to talk about stroke, the certification in stroke care, but this can be for any chronic illnesses that we take care of within an organization. Which button goes back?
The back. Oh, there's no back.
There's no back button.
No back.
Okay, thank you. All right, so American Heart Association came up with Get With the Guidelines in 2003 in order to streamline stroke care and improve outcomes and improve quality standards. So as part of Get With the Guidelines, they also came up with, thank you, Target Stroke. Target Stroke was an extension of Get With the Guidelines. Their goal was to improve door to TPA times for every stroke in less than 60 minutes. And when they first started Target Stroke, their administration rates of TPA were approximately about 20%. And their goal was to increase that administration rate to 50% of strokes within 60 minutes of onset. So they had participation from 1,600 hospitals and approximately 1.9 million patients. So once they started Target Stroke, you can see what a success this was, and they reached their goals within 2013. So how can we join this initiative? How can we help with this nationwide initiative to improve stroke outcomes and improve quality of care? So clearly there's an unmet need for stroke center certification. All over the country there has been lots of different centers coming up and a series of guidelines coming from the Brain Attack Coalition, which is an initiative from the National Institute of Health and the NINDS. So in 2005, they came up with the recommendations for the Comprehensive Stroke Center, and then followed by, in 2011, the recommendations for the primary stroke centers, and then in 2013 for the acute stroke-ready hospitals. And this is done by 3 different organizations: JACO, DNV, and HVAP. So currently, as you can see, there's a lot of different centers that are on board, getting ready, and already certified. So there's 1387 certified primary stroke centers and 135 certified comprehensive stroke centers. So what is stroke designation? Stroke designation is once you're certified in excellence in caring for the disease itself. Several states designate stroke hospitals based on the level of care provided to assist EMS in triaging which facility the stroke patient will be taken to. So there's level 1, which is a comprehensive stroke center. It's again done by JACO, DNV, and HVAP. There's level 2 primary stroke centers, again, Joint Commission, DNV, and HVAP. And level 3, which is statewide, JACO does this, HVAP, and then from Texas we have TTAF. Again, there's a series of states now. The state legislation is a newer concept, and certain states already have existing legislative policies in existence, or either legislative or administrative policies in existence, and there's more coming up every year. This is just a timeline to see which states have been on board already. So 20 states that have enacted or pending legislations or non-legislative administrative policies in place. So the EMS stroke triaging plan, so once you have your designation, so the American Heart Association published in 2007 what strategies EMS can use within the stroke systems of care to triage patients and appropriately refer patients to each hospital. And so there's a formation of the Regional Advisory Council in Texas, and this is how you can see within a geographical distribution, either by ambulance or EMS or helicopter, within what time you can get to which hospital. So for Texas as a case study, so Texas state passed stroke legislation, and then they came up with a task force. It was a statewide initiative to form the Governor's Emergency Trauma Advisory Council. They then empowered these RACs, these regional advisory councils, to form local members with EMS and members of the RAC and hospitals within the RAC counties. And then these region-specific EMS teams, they plan the triage according to the network of hospitals within that area. So the stroke triaging is crucial to success in treating strokes and dealing with brain attacks. The geographic access to the stroke patients, either air or land, is crucial, and up-to-date capabilities of hospitals providing stroke care, either level 1, 2, or 3, is also important. The nearest and most appropriate hospital for the stroke patient in the ambulance. So the EMS gets a triage whether it's appropriate in order to assess for time and the need to bypass a certain facility to take to another. And so today we're going to talk about different aspects of certification. So disease specific, we're going to speak about Comprehensive Stroke Center Level 1. We're going to speak about Primary Stroke Centers Level 2. Also acute stroke ready hospitals, which are Level 3. And carotid stenting and stroke rehab. Thank you. Any questions? Yes?
I just have a quick question. So it sounds like you have a very organized system in the state of Texas for triaging patients. We all wish that in different parts of the country we had such an organized system. What type of QA do you do is performed on that system? So do you monitor to make sure patients do go to the appropriate hospitals? Is there feedback for times or opportunities for improvement? And is there any reporting by region that you can sort of look at adherence to protocols and adherence to the EMS regulations?
Dr. Janardhan.
I'd actually like Sharon Eberlein to give that. She actually chairs the committees for exactly that question in North Texas. So there are around 17 or 18 regional advisory councils that have been empowered in the whole state of Texas. And each of these regional advisory councils have around 15 to 20 counties within them. So they bring all the EMS providers. There's actually a stroke task force. Sharon, do you want to comment on some processes in Texas that have worked that may be a role model for other states?
Absolutely, thank you for the question. To answer your question, yes. We have what we call a PI, a regional PI committee. That PI committee consists of EMS medical directors, physicians, nursing, and the paramedics in various counties. And what we do, if there is a question or a concern of a transfer to a higher level of care, to the same level of care, the hospitals can ask for the PI committee discussion of was it correct, was it incorrect, were all procedures followed. And then we close the loop by getting back with those facilities. It is a closed session meeting just because of the nature of the business and the information. So yes, we do indeed follow up and then follow through. And it may mean we need to change our stroke regional plan, or it may mean we need to tweak something with the EMS providers in that county.
And then you obviously update this as changes occur within each region. So if someone becomes a comprehensive stroke center or moves to a different level, you do.
Absolutely.
Because that seems like a lot of administrative work. And so do you do it on a quarterly basis, or do you do it each time a hospital updates? Or
Each time a hospital updates, we submit the information to our Regional Advisory Council, and it's updated on our webpage and on our board. So if somebody goes from a primary to a comprehensive, that is indeed updated. If an EMS agency changes their protocols, then an email blast is sent out saying, the EMS agency X changed its protocol. So absolutely, it's kept updated.
thank you.